Hello, my name is Tiffany. It is January 29th after 10 p.m. Upon entering the room, I shut the door for privacy. I have my supplies already gathered at the bedside. Mr. Smith, my name is Tiffany and I will be be your nurse. Can I have your name and date of birth for verification purposes? John Smith, 9/19/52. All right, thank you. So as mentioned, there was an order already seen in the chart for his central venous dressing change. So what I'm going to do today is look around at your current dressing, make sure that looks okay. I want to take it off, clean you up, and put a fresh dressing on just so we don't get any type of infection by harboring bacteria from a dressing that's been in place for a few days. So what I will do now is, can you confirm for me if you have any allergies to any tape or cleaning solution? No? Okay, great. The next thing I will want to do is I will raise the bed up to a good working position. The patient will be in semi-Fowler's position. And Mr. Smith, I will ask you to please turn your head away from the site that I will be working at. I'll wash my hands and then we will get a mask on you and then a mask on myself. So again, wash my hands, apply a mask, apply clean gloves. Okay, so let the patient's head turn around, good working position, in semi-Fowler's position. Before I remove the dressing, I would want it to kind of take around at the current dressing in place. Make sure there's no pain, odor, anything that would be indicative of any type of infection. So kind of just feel around, and there is not. So I would want to remove the old dressing using an up and away motion as well as removing the stabilization device. So again, going down, going in an up and away motion, and then throwing the old dressing into my trash receptacle. So now with the dressing off, I would want to continue assessing the area. There's no pain, tenderness, no odor drainage. Everything looks good. I would then want to measure the remaining catheter sites, make sure there is no migration. So using my ruler, okay, got a measurement. Next thing I will want to do is remove my clean gloves, dispose in the trash. And then I will wash my hands and then open up my sterile field. Take out my sterile gloves. Due to the limited space that I have, I'm going to put them right here. With my sterile gloves in place, I then would want to take my chlorhexidine swab and then clean the insertion site and around the skin using a back and forth motion for 30 seconds. Dispose in the trash, let it dry. Using my antimicrobial swab, I would want to scrub at the lumen site. Let that dry, dispose. The next thing I would want to do is place an impregnated dressing on top a new stabilization device. I'll have my new dressing. Open this up. Apply over the site. I then would peel around the edges to take that off. I then would want to, on the dressing, label it with initials, date, and then when a new dressing change would be needed. The next thing I would want to do is lower the bed back down, make sure the patient is in a good, comfortable position. The call bell is in reach. Mr. Smith, are you comfortable? Are you having any pain at all? No? So what I would want to do next is remove my gloves, maestro, and then I would dispose of all of my supplies, and then I would wash my hands.